We've had to obey rules on covering our faces, who we can see, whether we can go out at all. In 2 weeks' time, all this is likely to look quite different, as the government announces masks and most other legal restrictions will become a matter of personal choice.
We must take a careful and a balanced decision. And there's only one reason why we can contemplate going ahead to step 4 in circumstances where we'd normally be locking down further. And that's because of the continuing effectiveness of the vaccine rollout.
The latest data shows that although the number of cases has risen rapidly over the last month, the number of deaths over the same period has stayed low. But the chief scientific advisor sounded cautious.
The link between cases and hospitalisations and cases and deaths is weakened, but not completely broken, and we would expect to see some further increase. We are in the face of an increasing epidemic at the moment, and therefore we need to behave accordingly in terms of trying to limit transmission spread.
Despite that warning, all these changes are expected in England from July the 19th, if the government's tests are met next week. As well as getting rid of the legal requirement to wear masks, all limits on social contact will go. The guidance on working from home will be scrapped, and there will be no cap on numbers at events. Many scientists and doctors' organisations are suggesting that measures like mask wearing must be kept in place in order to alleviate pressure on the NHS. Why are you ignoring their concerns?
I return to what we're trying to do with step 4 of the roadmap, which is get away from government legal diktat to relying on personal responsibility. And I do think that I will obviously wear a mask in crowded places.
The chief medical officer made it clear he would continue to wear a mask.
In any situation which was indoors and crowded or indoors with close proximity to other people. And that is because masks help protect other people. This is a thing we do to protect other people.
Cases in the UK are at their highest level since February. The British Medical Association are among those concerned that the rules on masks are being lifted too soon.
We're going to see emergence of other variants, and unfortunately some of those variants may be more severe than Delta. So it's in no one's interest to have spread of the virus, even amongst younger people. So wearing masks is a very, very simple way in which people have very effectively been protecting themselves and their families.
In Manchester, these people weren't sure about discarding their masks yet either.
Just because people will be taking their masks off doesn't mean I need to. It's everybody's choice, but I personally will be wearing a mask.
Some people could get on a bus and somebody isn't wearing a mask, and but everyone has to understand it's an individual preference, isn't it?
I might still wear it on public transport, but the rest of the time, not at all.
In the Commons, the new Health Secretary also announced a relaxation of measures in schools.
On July the 19th, it is our plan to remove bubbles and to end the requirement for early years settings, schools or colleges to routinely carry out contact tracing.
For the Labour leader, it's too much, too soon.
Lifting all protections in one go when the infection rate is going up is reckless. A balanced approach, a proper plan, would say keep key protections. One of them would be masks in enclosed places and on public transport. That's a common sense position.
There is consensus that COVID rates will continue to rise. Restrictions may be on the way out, to the delight of many, but the risks aren't gone yet. Romilly Weeks, News at 10.